Bismillahirrahmanirrahim. Fourth year, today we will start chapter number 18, which is the elbow and forearm complex. The PT1 subject is composed of two different subjects. These are therapeutics, regional therapeutics, and neurology. And before summer vacation, we had covered the topic of neurology, that was traumatic brain injury. Okay, and now we will cover our regional therapeutics, and we will cover the elbow and forearm complex. Boys and girls, the elbow joint is a freely mobile and strong joint. That is a freely mobile joint like a shoulder, but unlike to shoulder, that is a stable joint, and that is required for activities of daily living. The activities of daily living like eating, dressing, grooming, etc. These activities required much participation of elbow joint, and for the performance of activities of daily living that require 100 degree arc of flexion and extension at the elbow, and specifically between 30 degree and 130 degree, as well as 100 degree of forearm rotation, that which is equally divided between pronation and supination. So we already talked about the activities of daily living, such as drinking and eating primarily require elbow flexion, and tasks such as reaching to tie shoelaces also require elbow extension. So the elbow flexion and extension is required for the performance of activities of daily living. And injury or disease to bony or articular or soft tissue structure that can cause pain and can compromise joint mobility, strength, and stability. So for this, in case of any injury or disease, we will assess that joint, and we will use the pressy that include performance of active range of motion and then passive range of motion, and then performance of special test to make a differential diagnosis to find out the probable cause of the pain and compromised joint mobility. Now the structure and function of the elbow and forearm. The articulating surfaces are the distal end of humerus, which has two articular surfaces. One is trochlear, which articulates with ulna, and the other is capitulum, which articulates with the head of radius, making elbow joint. So mainly flexion and extension occur between these two joint surfaces, and the radius also articulates with the radial notch of ulna, which is called as proximal radio-ulnar joint. So the capsule of the elbow encloses humero-ulnar and humero-radial and proximal radio-ulnar articulations. So we just have discussed the two articulating surfaces on humerus, which articulates with radius as well as ulna, making elbow joint, and also the radius, which articulates with the radial notch on ulna, making proximal radio-ulnar joint. Now the elbow joint characteristics and orthokinematics. The orthokinematics of joint is defined as these are the accessory motions happening inside the joint capsule, and the examples of these accessory motion are gliding, sliding, or spinning motion occurring within the joint capsule. Now the elbow joint, that is a compound joint with a lex joint capsule covering the joint and supported by two major ligaments, and these ligaments are on medial side. These are ulnar collateral, and on lateral side these are radial collateral ligaments, and these ligaments provides medial and lateral stability respectively, also called as valgus or varus stability. Boys and girls, the elbow joint is most stable and strong joint with limited to no chance of dislocation at this joint. In the start of lecture, we have discussed two articulations. One is humero-ulnar and other is humero-radial articulation. Now let's describe the characteristics of humero-ulnar articulation. The humero-ulnar articulation is a modified hinge joint, and the trochlea, which is on medial side, which is medially placed at the distal end of humerus, which is convex. So the convex surface of trochlea at the distal end of humerus, it faces anteriorly and downward 45 degrees downward from the shaft of humerus, and the other articulating surfaces, which is concave trochlear fossa on the proximal end of ulna. So the concave trochlear fossa on the proximal end of ulna and convex trochlea, which is at the distal end of humerus, these two articulating surfaces make up a elbow joint. The concave trochlear fossa is faces upward and anteriorly 45 degrees from the ulna. These two, which are most congruent surfaces, concave and convex, make up a humero-ulnar articulation, and the primary motion at this articulation is flexion and extension. So we have discussed the characteristics of humero-ulnar articulation, where convex and concave congruent surfaces make up a humero-ulnar articulation, and the primary articulation is flexion and extension. Boys and girls, please pay attention. We have already defined arthrokinematic, that which is accessory motion occurring within the joint capsule, and the examples are the gliding, sliding and spinning motion within the joint capsule. So during flexion and extension, the concave fossa slides in the same direction in which ulna moves. So here let's describe the concave convex rule first. Whenever the moving surface is concave, like the trochlear fossa on ulna, that is a moving surface. So whenever concave surface is moving, the gliding, sliding which will occur in the same direction as the physiological motion of the arm. So let's take the example of elbow joint. If in case of flexion, the elbow is, the physiological motion is anteriorly directed, so the gliding, sliding will also occur in anterior direction. So that is according to concavo-convex rule, in which if the concave surface is moving, the gliding, sliding, which is accessory motion occurring within the joint capsule, will occur in the same direction as the physiological motion of the body part, like forearm. So with elbow extension, the fossa, the trochlear fossa on ulna, that will slide in posterior and proximal direction. The characteristics of humero-radial articulations, these are That articulation is a hinge pivot joint, and here the articulating surfaces are spherical capitulum at the end of humerus, with the other bony part is the head of radius, which is concave, and that is a moving body part. The radius, the concave body partner, that is a moving part, and that is at the proximal end of radius, whereas spherical capitulum is at the distal end of humerus. So here the primary motion are flexion, extension, and supination and pronation occur at this articulation. Here also the concavo-convex rules apply, and here the articulating surfaces is concave, which allows the gliding sliding in the same direction as the physiological motion of the forearm. Now the last slide of today's lecture, which is summary of joint arthrokinematics of elbow and forearm joint. So on right side there is roll and slide, and on left side there is physiological motion. So let's start this with humero-ulnar articulation. So whenever there is flexion at humero-ulnar articulation, the motion of ulnar joint surface will be anterior, and the direction of slide would be the same as the physiological motion, that would be anterior/distal. And in case of extension of the humero-ulnar articulation, where the motion of ulnar joint surface is posterior, so the sliding, in that case the sliding will be same as the motion of ulnar joint surface, and that would be posterior or proximal. So here the gliding, sliding are in the same direction of physiological motion. Now the humero-radial articulation, where we will discuss flexion as well as extension, and in case of flexion the motion of radial joint surface would be anterior, and also the direction of slide would be anterior. And in case of extension the motion of radial joint surface would be posterior, and also the sliding within the joint surface would be posterior. So gliding and sliding would be in the same direction of physiological joint motion. Now the forearm varus and forearm valgus, where that would be in opposite direction. So when the motion of proximal forearm is medial, the glide would be lateral, and when the motion of proximal forearm is lateral, the glide slide would be medial. Now let's discuss proximal radial joint and distal radial joint, where these rules apply in opposite. So when there is pronation of the proximal radial joint, the motion of rim of radial head would be anterior. So in case of pronation of proximal radial joint, the motion of rim of radial head would be anterior, but the gliding, sliding occurring within the joint would be posterior. So it would be opposite as compared to motion of rim of radial head. Okay, and in case of proximal radial joint supination, the motion of rim of radial head would be posterior, but the gliding, sliding occurring within the joint would be anterior. So that would be opposite to physiological motion occurring at proximal radial joint. Now the distal radial joint, where in case of pronation the motion of distal radial joint surface would be anterior, but the glide slide would be same anterior. Okay, so now we are discussing distal radial nerve joint, where when pronation, motion of distal radial joint surface would be anterior and the gliding sliding will be in the same direction and it would be anteriorly directed. And in case of supination, the motion of distal radial joint surface would be posterior and the gliding sliding also occur in the same direction and it would be posterior. Okay,